I am Rotarian Dr. Venkateswara, Venkatapadma Hospital, Senior Pediatrician, Vijayanagaram. October 18th to 24th is the World Antimicrobial Awareness Week. Thus, I want to give some information about this important topic today. So, what is the necessity of discussing about this program is, awareness program is, antimicrobial resistance is one of the top 10 global health threats identified by the World Health Organization. We are expecting by 2050, antimicrobial resistance could cause nearly 10 million deaths per year globally if not controlled. In India alone, antibiotics are widely misused due to the over-the-counter availability without any prescription. The use of counterfeit medicine and spurious medicines, and many people are resort to the self-medication. Even if they start the antibiotic, they will stop antibiotic once the symptoms are reduced. And the most important thing is lack of awareness among the public and the chemist. So, what is the current situation in India especially? The current situation in India is because of unrestricted sale of medicines. Many antibiotics can be purchased without a doctor prescription. Some pharmacies dispense just 2 tablets or very shorter course when any patient demands. The untrained staff often suggest antibiotic as a quick relief medicine. The most important myth is antibiotics cure viral fevers, cold, throat pain. The most dangerous misconception is if we feel better, we can stop the medicines. The other wrong notion is strong antibiotics leads to the stronger cure. These are all some of the misconceptions by the public. So, really, what is meant by antimicrobial resistance? So, for example, microorganisms like bacteria, viruses, fungi, parasites, they change and resist the drugs meant to kill them. Even if you start any antibiotic to kill any fungi, virus or bacteria, the bacteria are resistant to drugs. Because of the antimicrobial resistance, common infections become difficult to treat. We are expecting in the future, even a small cuts or wounds will kill the people. The other important problem is hospital stay become definitely longer. And medical procedures like surgeries, chemotherapy, and admissions in the NICU, that is neonatal intensive care unit, pediatric intensive care unit, and medical intensive care unit, whatnot. Any ICU care is becoming risky. So, for example, if you take some of the examples in India, the wide prevalent drug-resistant tuberculosis, even multi-drug resistant urinary tract infections is a big threat now, and typhoid fevers are resistant to many drugs, and resistant pneumonia, and post-operative resistant infections. So, what is the role of chemists? Why they are very crucial? Because the pharmacists are the first contact for many people in India. They can either fuel the antimicrobial resistance or they can help to prevent it. So, what not to do by the chemist? Do not give any antibiotic without prescription. Do not sell partial strips or incomplete courses. Do not recommend any antibiotic combinations. Do not stock or sell any spurious, suspicious or counterfeit drugs. Do not supply expired or poorly stored medicines. Some drugs you need to keep it in the refrigerators. If there is any frequent power failures, naturally the bioavailability of the drug is dismal. What chemists should do? Some of the important global best practices are, especially UK, Japan, and Singapore, Australia. Many countries enforce this. What only antibiotic dispensing follow the prescription only. Only after prescription only they have to supply the drugs, and they have to refuse partial strips and always verify the authenticity of the drugs, whether approved by the government of India or WHO, like this, and we have to educate the patient for the complete full course. The other thing is, important thing is proper storage of drugs. There are many drugs are temperature controlled storage, and we have to avoid sun or heat exposure in many drugs. If they have observed any suspicious stock, report immediately to the local drug inspectors. Do not substitute any brands in antibiotic without a doctor's approval. So, what is the important information given to the public? What the public must know: antibiotics do not cure, especially cold, fever, viral infections, sore throat, even COVID or routine flu infections. Only a doctor can decide if any antibiotics are needed. What the public has to do, they have to complete the full course and use medicines only when prescribed. Prefer government approved pharmacies. Always check the expiries. Always vaccinate your children to prevent infections and reduce antibiotic usage in the future. What public they are supposed not to do? Don't demand antibiotics from the chemist or a doctor. Don't share leftover tablets to the family members or to the friends. Don't use any old prescriptions. Don't stop the medicines when you feel better. These are the important don'ts followed by the public. So these are all the important things everybody should know. So the only because the important thing India must take is important policy recommendations like ban sale of antibiotics without prescription, increase the number of drug inspectors, and every strip of antibiotics should be monitored. Strengthen pharmacovigilance and reporting. We have to create some awareness meets, talks in schools, colleges, and public platforms like Rotary and even my organization like Indian Academy of Pediatrics. We always prefer rational antibiotic. We use it to talk about this rational antibiotic in every meetings, even every conferences. And every hospital should have an antibiotic step committee and follow. These are all the important things everybody should know and follow. Thank you very much.